We are where Atlanta speaks, and we hear your concerns as pediatric COVID-19 cases climb.
Yeah, 11 Alive's Paula Soro spoke with a child who went through COVID, and she says she's lucky she did not end up in the hospital.
I was in my room one day laying down and I had body aches and a headache at first.
This is how 15-year-old Giovanna Stokes spent her last weeks of summer.
A couple days later, I started feeling worse, but then they put me on medicine, antibiotics.
Quarantining after testing positive for COVID-19 in late July, just 3 days after her mother, Ollie Moore.
We were just a blessing to pull through and still be here alive and healthy, even not being vaccinated with having COVID.
She calls it a blessing because she's seen the 7-day moving average uptick in pediatric cases, and her daughter, who has asthma, was part of these numbers.
I'm grateful that I didn't have to go in the hospital because it would have made it even worse.
According to data from the Department of Public Health, over the past 2 weeks, kids ages 0 to 17 made up an average of 18% of cases in Georgia. Now, compare that to the worst of the winter surge back in January. Kids made up 11% of the cases. Right now, 10 to 17-year-olds make up the largest portion of confirmed cases for children in Georgia.
I was shocked at first because I thought it really couldn't affect kids, but when it did, I was kind of surprised.
While pediatric infectious disease experts say there's no hard evidence that proves the Delta variant is making the virus more dangerous for children, the CDC's director said during a briefing today that it's working to figure out if there could potentially be a connection.
With kids going to school now, it's going to be even more alarming. And trying to get kids within that age bracket to keep the mask on and keep sanitized